Dr. William Bay made headlines around the world when he interrupted an AMA conference in Sydney during a presentation by Australia's top doctor, Professor Paul Kelly, while live streaming the entire event. Since then, he has had his medical licence suspended by AHPRA, Australia's Health Practitioner Regulation Agency. In a time where we are seeing more and more doctors having their licence suspended, it's important to hear from the man himself and why he took the drastic action he did. Dr. Bay, thank you so much for joining me. Am I still allowed to call you Dr. Bay?
Well, in Australia, Natalie, that comes with a $60,000 fine and 3 years jail, but hopefully they won't get you over there in the USA.
Okay, well, for the sake of this interview, it will be William or the suspended Dr. William
Dr. William
Bay.
Bay, yes.
I just wanted to start from the very beginning. You are you were a GP registrar. Does that differ from somebody that the public knows as a GP, or is it the same thing?
Yeah, so what that means is I was in a training program to become a fully fellowed general practitioner under the Royal Australian College of GPs. So for most of the public, they're not sure of the difference, but there is a difference in that I'm considered more of a junior doctor, which I consider means that, if anything, my senior doctors here in Australia should have been helping me and speaking out more than they already have been, because why is it taking a junior doctor to stand up for the truth, for the right to informed consent? Why aren't they out there helping me? That's my question to the doctors of Australia.
One of the things that I noticed when I was reading the articles that have been published about you, there was a lot of name calling in the mainstream media. So I think my next question would need to be, are you some crazy quack that is endangering the lives of the Australian public?
Well, that's what our medical board in Australia has found. They have found me guilty of 43 charges of being a serious risk to the public health and the public safety of Australia. So if you take their point of view, then that's who I am. However, I dispute that, and I have submitted 45 pages of legal arguments and medical arguments attesting to why I believe that they are wrong. The interesting thing about my trial, my case before the medical board, AHPRA in Australia, Natalie, is that of all those pages of medical and legal arguments that I submitted, they did not address a single one of them. They did not find me guilty of any patient harm or of any erroneous statements relating to COVID-19 or the vaccines. All they did was find me guilty of contradicting and criticizing government ministers, government members, and government policy. That's what they are so angry about. So I have conclusively proved, in my opinion, that I am speaking the truth, and they haven't even argued against that. They are just upset that I'm not following the narrative.
One of the things that has stood out to me about this whole process that you've been through so far, and you've been very vocal about it, you've live streamed reading the response for the first time and finding out that you were suspended, even though that was the expected outcome. The contradicting government members and politicians, that's the one that I found most interesting, because I understand, and it's irrelevant whether I agree or disagree, I understand the contradiction to the head of the medical bodies, because they are the people that govern the whole medical industry in Australia. But the questioning the government ministers, these aren't doctors. These are people that have been put into power, voted in by the people of Australia in most cases. I mean, to me, a doctor should be able to question those people.
Absolutely. I believe strongly in the right to freedom of speech and the right to political communication. The Australian Constitution has some implied freedom of speech, not directly, unfortunately, like in the United States. But we do have more explicit protections over political communication, political free speech. And it's really disappointing and outrageous that AHPRA, the Australian Health Practitioner Regulation Agency, has found me guilty of criticising the government. They even named people that I criticised, like the Premier of Queensland, Anastasia Palaszczuk. They were upset that I'd made fun of her, basically, which I admit it. But my opinion is, so what? We do have the right to freedom of speech for the most part in Australia, and finding me guilty of that, in my opinion, just makes me more credible as a doctor, because they haven't even alleged that I've done anything wrong with the patients. They've just purely found me guilty and then suspended me indefinitely for criticising the government message. What are they afraid of? I have repeatedly challenged government members, government ministers, chief health officers. I've challenged the Chief Medical Officer of Australia, Professor Paul Kelly, to a debate regarding these vaccines, and not a single one of them have taken me up on that offer.
In the media, you've been criticised for speaking to podcast hosts, independent journalists like myself, Maria Z. Is there a reason why you haven't spoken to the mainstream media? Because if you have, I haven't been able to find it.
I have tried comprehensively to speak with the mainstream media, so much so, in fact, that we have held several protests, I think 3, maybe 4 protests directly outside the studios of the mainstream media in Australia, including the ABC, Australian Broadcasting Corporation, Channel 7, and Channel 9, where we literally, Natalie, stood out the front of these organisations and held rallies and begged them to come out and talk with us to get the message out to the world, but they refused to. To Channel 9's credit, they did interview me, but of course they did not publish the interview.
You must have known going into that AMA meeting that what you were about to do was going to set off a chain reaction of events. What made you decide to take such drastic action?
God. I am a strong believer in a higher authority, and I believe strongly that we have a responsibility to our community and to him and to our own personal ethics, and of course to our patients. I wasn't sure exactly what would happen after the AMA meeting. In fact, I was actually surprised what did happen. I strongly believe that the audience would challenge me, would heckle me. After all, I am just a junior doctor, a junior registrar. But not a single one of those of my esteemed colleagues had the courage to debate me or even to call me out on what I was saying. They just literally ran out of the room. And so many accusations about the way I conducted myself have been made. I understand that, but I was there not to protect my dignity or not there to protect my reputation. I was there to break through this wall of silence that we have in Australia.
Whenever I am speaking to anyone, I go and do a deep dive into all the things that I can possibly find that are
Yes.
related to the issue. When I was doing it, there were so many things that I came across that I don't think most people in Australia are even aware of. So I'm going to rattle off the list. It's a long one.
Okay.
But I want you to tell me if this is a fair assumption that most of the general public are not aware of at least some of these, if not all of these. So first of all, doctors in Australia don't swear a Hippocratic oath. We hear everybody talking about HIPAA laws, but it's not actually a thing in Australia like it is in the US. This vaccine is still in clinical trials until 2023. So all who have taken the vaccine are actually a part of the clinical trials. The vaccine is still only provisionally approved by the TGA by reason of the COVID-19 emergency, which is why all of the states and territories keep extending their state of emergency so they're able to continue mandating this particular vaccine. All medical professionals are being gagged by AHPRA for saying anything that challenges their narrative. And finally, the Health Practitioner Regulation National Law and Other Legislation Amendment Bill 2022, which is currently being passed in Queensland. But that bill will change the way doctors practice medicine across Australia. So is that a fair assessment that most Australians aren't aware of all or most of these individual issues?
It's so heartwarming to hear those things said back to me, because those things have been exactly what I've been saying all of 2022. Today was my 35th protest, and we're in, as I said before, day 946 of the state of emergency. So yes, people are not aware that doctors in Australia, anyway, do not take an oath. We do not take the Hippocratic Oath, and that is a sad indictment on our profession, because perhaps if we did take an oath of medical ethics, then a lot more doctors would stand up and join with me. I personally have stood up and expressed my concern for patients because I have a strong connection to God and to ethics, and I believe that I must do that for the benefit of people, no matter what, regardless of what happens to me. In regards to the experimental nature of the vaccines and it being still provisionally approved, that is absolutely correct. Our former health minister, federal health minister in Australia, Dr. Greg Hunt, he said that we are part of the world's greatest medical experiment, and indeed, unfortunately, that is true. The experimental subjects were the Australian people that took the vaccines. The control subjects were the people like me who did not take the mRNA vaccines. And then you've also mentioned something very important to me and to Queenslanders and to Australians, which is that, health practitioners regulation, national law, and other legislation, Amendment Bill 2022, which you're right, it is something that's before the Parliament of Queensland right now, and it is hardly being talked about by anybody. And yet, this could be the most significant law to ever be passed, not just in Queensland, but in Australia. Because if they pass this law, it will apply automatically to every state and territory on our continent. And what this law is doing, by their own admission, by their own explanatory notes within this bill, it says that they will be changing forevermore the focus of healthcare from the patient to the public health message, to the confidence in the public health system, to the prerogatives and desires of the Department of Health. This is a unprecedented, radical departure from thousands of years of medical practice. Whoever heard of, or whoever would see a doctor that's not there for the patient. If they're going to bring in a law that's going to mandate doctors start taking care of the public health message rather than the patient, I would never see personally a doctor again, because why would I? Why would I trust a doctor that by law is not there for me? It's there for the government. It's extremely dangerous. It's extremely evil. And I just am shocked that they would admit to this so clearly, and at the same time, the mainstream media and hardly anybody else talk about it at all. So thank you for bringing that up.
So to the former Dr. William Bay, thank you so much.
Thank you very much, Natalie. Thanks for having me on, and God bless Australia and the world.